Hello, today we are going to study drugs used in the ischemic heart disease and the cerebrovascular accidents. Okay, and uh, firstly, we are discussing what is it, ischemic heart disease. It's one of the most common cardiovascular disease uh, in developed countries, and angina pectoris, which is the symptom of the ischemic heart disease, is the most common condition involving tissue ischemia, in which vasodilator drugs are used. The name angina pectoris denotes the chest pain caused by accumulation of metabolites resulting from myocardial ischemia. By far, the most common cause of angina is atheromatous obstruction of the large coronary vessels. The coronary artery disease, it is also called. So this is actually atherosclerosis. Yes, this is the most um, common reason of this disease, but not a single. The main ways which we go alone to eliminate the myocardial ischemia is to reduce the myocardial oxygen demand, to increase blood and oxygen flow there, to change the myocardial metabolism, and to improve the microcirculation of the endocardial layers of the myocardium. So why these ways we use? Because actually, the reason of our pain is that our heart works so much as it works on its maximum, we can say. Yes, it works really hard, so it needs a lot of energy. Of course, we understand when we work we need a lot of energy, we need to eat a lot of food to have enough supply of our body. Yes, and by this, uh, when for the heart this is not enough oxygen supply, when this is not enough blood supply, when the coronary vessels do not bring enough oxygen, the heart cannot functionize normally, because of course it cannot make the proper amount of energy. Yes, so it uh, works hard without enough oxygen. That's why it has a lot of the metabolites which produce pain. So what we can do, we can make our heart work less. Yes, so like relax it, more relaxation, so less energy needed, and the smaller amount of oxygen will be not a big problem. Okay, so it will be all right, it will be enough. Also, we can increase the blood and oxygen flow, so by dilating the coronary vessel, so it will bring us more oxygen, so we'll feel better. Okay, and also to optimize the metabolism and improve the internal circulation, yes, of the endocardial layer. So what are the drugs actually which work by these principles? The first group, drugs which decrease the need of myocardial oxygen. As I said, we should calm down our heart, make less work of our heart. So by that, we will have less demand for oxygen, less energy needed, less oxygen needed. And the drugs are beta blockers, which you already know, bradycardic drugs. Bradycardic drugs reduce the heart rate, yes, and the organic nitrates, nitroglycerin. This is the most popular, the most wide used drug, nitroglycerin. I'm sure that you have heard about that. So this is the drug which reduces the demand for oxygen of the myocardium. Also, we have the drugs which increase the delivery of oxygen to the myocardium, increase the delivery. So what are they? They are coronary dilators of myotropic action. That means they relax the coronary vessels, coronary arteries, so they bring more oxygen to the heart, to the myocardium. And they are dipyridamole, papaverine, carbapenem. Also, there are the drugs of reflex action. They also do the same, relax the coronary arteries. This is validol, actually not very effective drug, but it exists. Next, preparations of metabolic action that make the metabolism of the heart like more optimal. Um, Adaptation to this condition of low oxygen, yes. This is riboxine, for example. Also, we have cardioprotectors, which is trimetazidine. It is also a drug which can make the metabolism more um, like adapted to the current situation with low oxygen. Okay, sorry for that pause. We continue, and now we go on the organic nitrates. This is the group from the first list, yes, which reduces the demand of oxygen. And we have a lot of drugs like Sustak, it's a brand name, nitroglycerin, trinitrolone, nitron, arenite, nitrosorbate, isosorbate mononitrate. But here is the molecule of nitroglycerin. So we're going to talk about this drug because it's the basic drug of all organic nitrates. So here you can see the molecule of glycerin, which is the ester with the nitric acid, and O2 it has here. Yes. And actually this is the part which plays the most important role. Okay, what happens? The nitrates from the NO group, after reduction with the participation of self-hydryl groups of the glutathione in the vascular endothelium, the S-nitrothiols are formed and they activate the guanylate cyclase. So firstly, everything starts from these groups, which should be cut from the molecule of glycerin, yes? And this happens with the help of the special thiol enzymes, thiol enzymes. So, detaching of NO from this is the essential part of the mechanism, guys. So if we don't have enough thiol enzymes in our endothelium, so we don't have the effect of nitrates. Okay, please remember that. It is very important. Okay, so after detaching happens all that which I said. After detaching, we say that nitrates, when they already are detached, they form as nitrosothiols, and these as nitrosothiols, they already go to the muscular cell and activate the guanylate cyclase. Here we can see the scheme that guanylate cyclase converts GTP into the CGMP, and CGMP takes part in the calcium metabolism. Calcium metabolism, it means, not metabolism, but the level of calcium will be reduced. It is not shown here, I will write. Reduce the level of intracellular free ions of calcium, which leads to relaxation of our cells by detaching actin and myosin, so less actin-myosin complex, so less muscular contraction. And it relaxes our, blood vessels, okay? Here we can see the effects of the nitrates for the treatment of angina and the results of these effects. So what do we have? The decreased volume of the heart, volumes of the heart, they are the principles of the work, decrease the myocardial oxygen requirement. The vasodilation of epicardial coronary arteries relieve the coronary artery spasm, which helps to give more oxygen, yes, to the heart. Increased collateral flow improves perfusion in the ischemic myocardium. Decrease the left ventricular diastolic pressure, improves the subendocardial perfusion. So diastolic pressure reduced because that effect with the relaxation of muscles happens in veins, in peripheral veins, guys. Peripheral veins, please pay attention on that. Don't think that our nitrates, they work only in the vessels of the heart. No, not only in the vessels of the heart, in the peripheral vessels also, the veins and arteries. Okay, and the potential side effects are reflex tachycardia, which can increase again back, yes, the myocardial oxygen requirement. The reflex increase in contractility, this is also bad, and decreased diastolic perfusion time due to tachycardia. This is again very bad because it reduces all the good effects which we just had. Okay, let's go further. So what happens here in our coronary artery? Very often, we have the plaque, atherosclerotic plaque in the artery. And because of that, our vessel is like the lumen of the vessel is less. It's reduced, yes, okay. And the nitroglycerin and other nitrates, they provide NO, the oxygen nitrate, to the narrow atherosclerotic vessel and help them to relax and help them to make the lumen more. Nitroglycerin is much more effective on the venous vessels than arterial. So we should remember that causing the venous dilation is thereby helps to reduce preload on the heart, as I already said. Nitrates can be used in two ways. First is in acute situation to relieve the angina attack. Acute, when the patient has pain right now, we can use the nitroglycerin, sublingual tablets and aerosols of nitroglycerin and isosorbate dinitrate. And also the second use is for the chronic use, for the prevention of the angina attacks in future. In this case, we should not use the nitroglycerin because we need the prolonged action of drugs, and we use the prolonged action like isosorbate dinitrate, isosorbate mononitrate, the transdermal forms of nitroglycerin, Tuspac-Nitrom, Trinitolorong, ointments, and so on. The patch with nitroglycerin, again, transdermal effect. It affects for the long time, and nitroglycerin itself affects only for the short time. So we have already discussed some side effects of nitrates, and also what can be the increased intracranial pressure. Why? Because dilating the blood vessels in the brain makes the pressure on the brain itself, okay, which feels quite, how to say it, painful, okay, painful. So that's why patient can have a headache. Next, reflex tachycardia can be because dilation of blood vessels reduces the blood flow, the speed, yes, of the blood, and our heart tries to compensate that by quick contraction. That's why tachycardia. Lower blood pressure, of course, logically, because we dilate all the blood vessels. Methemoglobin formation. Okay, this is a difficult mechanism actually, but like remember just that this can be not often, but it can be. The recoil syndrome, ricochet. It is increased blood pressure, angina attacks with the sudden discontinuation of administration. So when you stop using the drugs, symptoms can come back because their effects, they are not prolonged, they are not smooth, they are really strong, and when you stop them, everything can come back again. Also, there is development of tolerance. Why? Remember when I said the essential step of the effect of the nitrate is to detach the NO molecule from nitroglycerin, yes? And it happens with the help of thiol enzymes. When we use a lot of this drug during the longer time, our thiol enzymes are, how to say it, especially, looking for the English word. So the amount of these enzymes becomes less, yes? So like we had more and now we have less. Depletion or exhaustion, like the cells are exhausted by a lot of use of these enzymes, and so we have depletion of these enzymes, and we have no detaching of NO from the nitroglycerin. Okay, the classification of the calcium channel blockers. Calcium channel blockers, they are also the drugs which can dilate the blood vessels and reduce the heart demand for oxygen. So here you can see the chemical classifications, and here are the drug names which you should remember. Nifedipine, felodipine, amlodipine, the most widely used verapamil, galapamil, glutazione, lintiazine. Beta adrenoblockers, we already know how do they work. You remember we have already studied them. They block beta receptors, they reduce the intracellular calcium also, and they reduce the work of heart. Yes, they stop that extra work of the heart. So the heart rate will be decreased, the pump function will also be decreased, so less work of the heart, less need for oxygen, less pain. And we remember about the drugs which are propranolol, non-selective nadolol, non-selective metoprolol, selective atenolol, selective betaxolol, selective nebivolol, selective beta-1 plus, also nitrate, yes, gives the NO group, bisoprolol selective, labetalol carvedilol, non-selective, also effect on alpha receptors and dilate the blood vessels along the heart, not the heart, in peripheral. Okay, what do the beta blockers do? Actually, here we can see their normal effects. We know already all of them. So this is very helpful that they reduce the heart rate and cardiac output, which reduces the hypertension and angina and the need for oxygen. Also, they block the excitability of anteroventricular conductivity, the membrane stabilization, which reduces arrhythmia, growth of cardiomyocytes. They also reduce, which helps to reduce hypertrophy, and they affect on lipid metabolism by reducing atherosclerosis. So many good effects in reducing the coronary like cardiovascular risks. Okay. Bradycardic drugs, as I said, also reducing the heart rate, like ivabradine reduces the automatism of the sinoatrial node, which reduces the need for oxygen. It gives us anti-anginal and anti-arrhythmic activity. How does it work? I mean by mechanism. Mechanism, it's the blocker of ionic currents. Okay, of the influx of the ions through the special IF channels. They are sodium potassium channels of the sinus node. The channels are the channels are able to be activated in the period of hyperpolarization of the cells. So what will be? It will reduce the rate of slow spontaneous depolarization. It will give the selective action on the sinoatrial node only, because only there are those funny channels. IF, this is funny channels. Funny, why they are funny? Because that's a competition. Funny. They are funny because normal channels they activate in case of depolarization when we have, we remember, yes, the depolarization when we have more um, potential of the membrane. But these funny channels, they activate in case of hyperpolarization. So in this moment, they activate when we have less potential of the membrane. And that's why they are funny. Okay, так, sorry. For this pause, I will erase all my. Так, selective action, reduces the heart rate and from diastole. Of course, it helps to use less oxygen. That's why it reduces the oxygen, demand, yes, the need of oxygen. Reduces the coronary perfusion. It has no negative inotropic effect. Interesting. That is interesting. Like a negative inotropic effect is the rate. Okay. Does not reduce the blood pressure, so works only in the heart, not in the vessels. Coronarodilators, so these drugs which just make the coronary arteries bigger, relaxed, okay, and bring more oxygen. Like dipyridamole, it inhibits the adenosine deaminase and inhibits the reuptake of adenosine. So it leads to accumulation of elevated concentrations of adenosine. A lot of adenosine will be here, and it strengthens the coronary dilating action of adenosine. Okay, the adenosine is the molecule which leads to relaxation of the coronary vessels. Okay, what else? I also said that there is a drug which is not very effective, but it exists. So this is Validol. It's the reflex action. Also eliminates the coronary spasm. Let's see the mechanism. It is not that good, but okay, let's see it. So Validol excites the cold receptors in the oral cavity. Why? Because it has the mantle in the in the content. It has mantle. Yes, it's like chewing some mint, okay, or like a mantle chewing gum, almost like that. Nothing special, seriously. Okay, the receptors, they send impulse to the middle and lower sympathetic ganglion. This sympathetic ganglion sent impulse to the beta-2 adrenoreceptors of the heart and coronary vessels. And we remember that beta-2 adrenoreceptors, they're responsible for relaxation of the vessels. So it leads to expansion of the coronary vessels, which increases the physiological delivery of oxygen, O2, and it improves the coronary circulation. As I said, this is not that effective because sometimes, how to say sometimes, more often is the situation when the vessels will not dilate because they have, for example, the atherosclerotic plaque. Cardioprotective drugs, these are the drugs which optimize the metabolism of the myocardium. So, for example, the trimetazidine inhibits the 3-keto-acetyl coenzyme A thiazolase, which makes the violation of beta oxidation of fatty acids, which leads to accumulation of acetyl coenzyme A. It participates in the oxidation of the glucose, which makes more ATP. ATP, yes, sorry, that's from Russian. ATP. Then it leads to normalization of the function of the ion channels in the heart and normalization of the energy metabolism of the myocardium in the region of ischemic. Okay. The drugs which we use in the myocardial function are these drugs in the list. So they are analgesics. We have already studied how do they work. They are used for the reducing pain because pain is very strong. Antiarrhythmic agents if there is arrhythmia. Cardioglycosides to stimulate the work of heart. Anticoagulants and antioxidants and fibrinolytics in the presence of the blood clot. How do these work? They reduce the risk uh, of the future complications, yes, of the future coronary risks, and also the sympathetic drugs according to the patient's condition. Uh, Also, there are some new methods of the treating of the coronary artery disease, like, for example, the introduction of the granulocyte growth factor directly into the coronary artery, the application of anti-complementary drugs, uh, tocilizumab, the increase of the expression of NO synthase in prostacyclins, which physiologically increase the relaxation of vessels. Yes, so these all are new and not the widespread methods of the treatment of our disease. The causes of okay, now we are going to the cerebral circulation pathology, and in our brain also there can be ischemia, which can lead to the insult. Yes, why it happens? Because of atherosclerosis, again, the most widespread disease, but we will further study how to prevent atherosclerosis. Spasm of the cerebral vessels sometimes, traumatic brain injury, of course, intoxications, and this metabolic disorder. Okay, these are also some reasons of the damage, actually, what will be. So if we have the ischemia in our brain, of course it leads to metabolic disorder because metabolism cannot be made normally without enough oxygen, yes. The development of acidosis, also it can change the release of mediators, reduce it, yes. Rapid entry of excess calcium ions into the cells so they can like be overstimulated, and also there will be the release of free radicals, which will absolutely sure damage your cell membrane. Damaging of cell membrane leads to the cell death. If your cells in the brain die, they never come back. Again, there are many drugs which are used for the treatment of the cerebrovascular disorders. They are drugs which increase the cerebral blood flow of the calcium channel blockers, L-type calcium channel blockers, nimodipine, cinnarizine, flunarizine, derivatives of alkaloids of the periwinkle plant, vinpocetine, or Coventon also is called. Derivatives of ergot alkaloid. Ergot alkaloid we have already studied. They work on alpha-2 receptors, yes, nisergalin. Nicotinic acid derivatives, sentinel nicotinate, GABA, and its derivatives. Remember, we have studied them in the nootropic drugs. Derivatives of purine alkaloids like pentoxetylene, they dilate the blood vessels due to accumulation of CMP. And the opium alkaloids of endocrinolone, papaverine, it also accumulates the CMP in the cells. Also, we have some anti-aggregants and anticoagulants because they reduce the blood clotting. So the calcium channel blockers actually, or nimodipine, cinnarizine, very easy. How do they work? They directly just block the calcium channel, so less calcium ions can get inside the cell and give less contractivity, and less stimulation of the cell. So the drugs are nimodipine. This is an example. Also, we have the alkaloids of periwinkle plant. Here is that periwinkle. They stimulate also the accumulation of CMP, which leads to reduction of calcium. Again, less calcium, less muscle contraction. Vinpocetine, it's the periwinkle plant alkaloid. Okay, it dilates the vessels, increases the deformability of the red blood cells, reduces the platelet aggregation, enhances the glucose uptake and metabolism, blocks the neutral sodium channels and neuronal, and decreases the pathologically increased blood viscosity. Nicergolin, as I said, ergodalkaloid, alpha-adrenoblocking activity, expanding the cerebral vessels, okay, and also we have some drugs for the migraine, which is also the problem of the cerebral circulation. So migraine is a neurological disease, the most frequent and characteristic symptom of which is episodic and regular severe painful attacks of headache in the one half of the head, one half, left or right. Often this is like that. Uh, the symptoms can be different in different patients. So we have that severe thrombin pain on the one side of the head, increased pain during daily exercise, nausea and vomiting, so much pain that even patient has vomiting. Just imagine, yes? Sensitivity to light, noise and smell, they cannot look at light. Uh, More often it occurs in women, and the role of pathogenesis of migraine is generally recognized that it has the serotoninergic system, serotoninergic. Because of the abnormal release of serotonin, our blood vessels constrict, then dilate, constrict, dilate, constrict, dilate, and this movement makes a lot of pain, and also the how to say it, the edema around this pumping vessel, it also makes pain. And here you can see the list of drugs which can also be used in migraine, but generally we can say that they are all like used for the controlling of the vessel, yes, the contractility of vessel. So we don't want our vessel to make this pumping, yes, because it makes pain. We want our vessel to be controlled, like in one position, okay? So these all drugs are trying to make one position of the blood vessels, constrict it more or dilate it more, but not this pumping, okay? So here again, this ergotamine makes vasodilation, yes, for example. It reduces the amplitude of the pulse fluctuations in cerebral vessels, reducing the plasma transudation, and also it blocks a little bit 5-HT ID1 receptors. Sumatriptan, the decreasing of serotonin release, the agonist of serotonin receptors, by decreasing of the release of serotonin, it also controls the tone of blood vessels and relieves the migraine attacks. And also sometimes we can use even non-steroid anti-inflammatory drugs like aspirin in big doses. For some patients it can be helpful, but not all of them. So the migraine is now a difficult disease which we don't know yet how to treat. We just try many different types of drugs, and the list you can see here how much do we try, but we actually don't find the answer on the question of migraine. Okay, thank you for your attention. See you in class.